Many of you in your families or friends' families know of a child who has autism. Today I'll be sharing with you the effects that autism has on the family and on the child's schooling and daily life. Also, I will explain what autism is and how to notice the signs. Two of my youngest siblings have autism. My sister is 15 and has a case of severe autism, and my brother is 13 and has moderate to mild autism. I will first explain what autism is, then I will explain how it affects the family, and then the effects that it has on the child's life and how to help them cope with this and learn and develop their lives. I'll be using many stories of my own to explain all of this since it is such a personal thing. Alright, so beginning with what autism is and some facts about it. According to Autism Speaks, autism is a mental disorder that affects a person's social skills, learning skills, and behavioral skills. There are different levels of the severeness of autism, ranging from mild to moderate to severe. By the time the child is 2 to 3 years old, you can begin to see the signs of autism appearing if the child is struggling with the autism. It is important that once you see the signs, to get the child help. This can be offered through therapy or medications or even a combination of both. If you do not catch the signs of autism early and get the child help early on, they will become even more delayed with their learning and their social skills. Some facts also from Autism Speaks. There are 1 in 42 boys are affected with a type of autism, and 1 in 189 girls are affected. About 1/3 of the people with autism remain nonverbal, and about 1/3 of people with autism have an intellectual disability. And there can also be other disorders that come along with autism, such as anxiety, depression, ADHD, sleep disturbances, and also seizures. It affects the family in this way. When my parents found out that my sister had autism, they were surprised. They weren't quite sure how to handle the situation or to handle her, but they were guided to get her a therapist, which my sister had for many years. And they also put her on medication to help her remain calm, and she has some sleep disturbances, so we have a medication that she takes at night to help her sleep, and then one in the morning to wake her up. When my brother was born, they were once again surprised to see that another child had autism, but they could see that it was not as severe. He also would have a therapist and medications to help him. So we must be patient with the kids who have autism. Trying to help them learn or even talk can be a struggle, and it will take time and practice. I've learned over the years that they will always be this way, but that we can help them progress and become better. Their life certainly isn't easy, and we must understand that they need our help. So it affects the child in this way. My sister's symptoms were noticeable at age 2. When you would call her name, she would not respond or even look at you. She would try and hurt herself and also try and hurt others. She did not know how to communicate properly, but with therapy, she was able to learn manners and know how to act. She is now a freshman in high school, and some kids make fun of her because of her level of learning is still low. But as a family, we show her love and let her know that she is important because that is what she needs, and other autistic children also need support. My brother is not as severe as my sister. He used to not talk, but now he will talk your ear off. But he will throw fits that are not necessary and does not know how to handle his emotions very well. He is really smart and can retain lots of information. As a child, he had a therapist for a few years to help him learn how to take care of himself and how to treat others. And he also takes a medication daily to help him stay calm and handle his emotions. So, as you can see, autism affects the child and the family. We need to make sure that these children are taken care of and have the resources that they need. When these children get the help that they need, they will benefit. They can succeed in their learning and develop better social skills. These children need help and cannot be left on their own. If we do not help these children, they will not be able to learn and grow. They will not be able to control their emotions without being taught how to. Also, they will not be able to communicate with us if we do not teach them how. We need to step up and help the children who are struggling with autism. We need to be their friend because they may not feel that they have any friends. So, restating the problem, if these children do not get help, they will not be able to function on their own and they need our guidance. But if we get the help that they need, they will be better off and we can help them and teach them how to communicate and cope with autism. We need to step up and help these children, such as my brother and sister. We need to be their friend and show them support and love. I love my brother and sister. They are unique and they complete our family. Our lives would not be the same without autism in our lives.